Cognitive dysfunction is common in patients with major depression. That one is a well-established fact. But as clinicians, we really do want to understand what is the process we should employ in order to detect it in our patients. I have several suggestions for you, dear colleagues. The first thing is be very aware that about 70% of patients with major depression have cognitive dysfunction that is causing impairment in their lives. 70%. In other words, it is better to assume a patient has cognitive dysfunction rather than assume the contrary. Therefore, let's look for it proactively. The way I go about doing it is, first of all, ask the patients direct questions. So I often ask them, since depression has set in, I understand you're having trouble with, say, tiredness, sadness, etc. I also ask them directly, are you having trouble with your memory? Are you having trouble with focus? Are you having trouble with making decisions? And very often my patients say this to me, how did you know? How did you possibly know that I'm having those difficulties? I've not shared it with anybody. Well, the reason why I know it is because it's part and parcel of the disease of major depression. I often use standardized instruments to help me confirm my worries and also to then track their symptom improvement. There are two scales I like and I would like to recommend to you. The first one is called the CPFQ. We have a great deal of experience using that scale. There's another scale that's available called PDQ-5. It doesn't matter which scale you use as long as we do use one. But the key thing to remember here is be suspicious, be aware that cognitive dysfunction occurs, ask proactive questions, make sure your treatment options follow that paradigm, and I'm certain success will come your and your patient's way.